Good morning, everyone, and thank you for joining us today. I'm Mariette, and I'm joined by my colleague Hazel. We're both training specialists at Ardens. The focus of today's webinar is on implementing the Ardens LTC Annual Recall System for EMIS practices. Now, if you're joining us from System 1, just to flag that this session is EMIS specific, so it may not fully apply, but we're happy to share the recording and the resources from the System 1 session that took place earlier this week. Now, over the next hour, we'll walk you through what's changing, why we've introduced these updates, what resources are available, and how you can start preparing for the implementation. We'll then move into a live demonstration where Hazel will show the system in action, take you through the practical workflow. Before we begin, just a few housekeeping points. The session is being recorded today, and the recording will be shared with you afterwards. So if you miss anything or want to revisit the discussions, you will be able to do so. To ensure that we get a clear and high quality recording for you, microphones have been disabled for this webinar, but we really do encourage your participation. So please feel free to submit your questions at any time using the Q&A feature along the top of the meeting window, and we'll do our best to answer these as we go along. The Q&A is separate from the chat function, which have been disabled, so please just look out for that little Q&A symbol and you can pop your questions in there. The session will last approximately an hour, though this may vary slightly depending on the number of questions that get raised. And finally, if you experience any audio issues during this session, the best fix is usually to leave the meeting and rejoin. Today's session is split into 4 main sections. First, I'll walk you through the overall process and explain the key changes. We'll then look at some important things to consider when implementing the system in your practice. After that, Hazel will demonstrate the resources in EMIS and show you how the workflow works in practice. And finally, we'll cover next steps along with the training and support available to you to help you with your implementation journey. Now, before we dive in, it would be really helpful to understand who we've got with us today. So I'm just going to launch a quick poll, so please do let us know what your role is in your practice. So that should be live on your screen at the moment. So have a little look on there and just let us know what your role is. So the results are starting to come in. So far, mostly administrators, about 69–70% there, some practice managers. We've got a nurse on the call today and some other roles as well. Brilliant, it's lovely to see those numbers. So thank you all very much for joining us. So I'm just going to get the next poll ready. So we'd also like to see whether you're currently using the Ardens LTC Recall System, and if so, which version you're using. If you're using something different, feel free to pop that in the Q&A so we can see how you're currently managing your recalls. So on the screen now, you should see a poll there for you to indicate what system you're using at the moment. So let's see what results are coming in there. So a few of you are using System A, System B. We've got some System C users. Oh, and we've got someone already using the new system, Hazel. So that's good. And a few of you have said you're not using the Ardens system. So it'd be interesting to see what you guys are using. So thank you all for submitting those responses. That gives us a bit of a better idea of who we've got with us today. Now, many of you will already be familiar with the existing Ardens Recall resources. They've worked well for a number of years, but we've taken the opportunity to redesign this process so it better supports a more complete approach to your long-term condition management. One of the biggest changes is that we've included best practice conditions alongside your QOF conditions. This means you can manage a wider group of patients through one consistent recall process rather than focusing only on those contractual requirements. We've also introduced improved templates to help you better data capture, clearer decision support, and identifying patient risk during any of your reviews. You'll also notice that the searches and reports now follow a more standardized layout, bringing them in line with other Ardens recall programs. So why have we made these changes? Firstly, to support a whole long-term condition approach rather than just focusing on the annual review itself. Secondly, it's to make the recall pathway simpler and easier to manage with a clear and structured workflow. And finally, to get practices ready for future changes over the next few years, so you're in a strong position to make the most of any upcoming developments. One of the questions we're asked frequently is when practices move across to the new system and when you need to make that move. So the good news is that you don't have to make an immediate switch, but the sooner you start, the better. Currently, the LTC Recall System templates and searches will all remain in place until April 2027. So you've got time to plan your transition and introduce the new approach in a way that will work for your practice. That said, though, April 2027 can come around really, really quickly, especially in that final quarter where you've got lots of things happening with your winter pressures and QOF deadlines. So we would really encourage you to start thinking about your transition now to avoid that last minute panic towards the end of the financial year. A successful implementation will involve both your clinical and admin teams, and it's really important to allow time for training, testing, and embedding that new process. The new resources are already available, and these will include your LTC review reports, the annual review launcher, the initial assessment template, and the LTC review template. And these all work together to support the full recall pathway, which we're going to look at on the next slide. So one of the biggest differences with the new system is that it's been designed around a complete long-term condition pathway. That pathway consists of 5 stages. So you've got plan, notify, assess, review, and evaluate. Rather than focusing on the review appointment itself, the system then supports your practice through that whole patient journey, from identifying who needs recalling right through to monitoring the activities and the outcomes afterwards. So now we're going to look at each stage in just a little bit more detail. So this slide shows how different members of the team contribute to each stage of this pathway. The first stage is plan. So this is usually led by management teams and focuses on confirming which patient needs recalling and when those recalls should happen. The next stage is notify, and this is where your admin teams choose the best way to invite the patients in for their review and then do that invitation stage. The third stage is assess. So this is often carried out by healthcare assistants or a nurse and can involve collecting information such as observations, blood tests, and any other relevant clinical data. You've then got your review stage, and this is where a GP or specialist nurse looks at the information that's been gathered and makes any clinical decisions. And that could be through a face-to-face appointment, a phone call, or messaging workflows. Finally, you've got your evaluate stage, and this helps you to monitor progress, activity, and your performance so you can see how well the recall program is working. So overall, this pathway helps make sure that the right work is done by the right people at the right stage. The system offers flexibility in how you implement your recall program. As a practice, you can choose whether you want to focus just on your QOF conditions only or whether to include both QOF and best practice conditions. The conditions are grouped into logical categories, so you'll see cardiovascular, renal and metabolic together. You've got respiratory conditions, mental health, musculoskeletal and so on. This means you can take an approach that works for both your contractual requirements and any local priorities that you might have. If you're just starting out, it's worth thinking about this process and which solution would fit you best for your population and the available capacity you've got before deciding on your switchover date. Now, before we move into the demonstration, it's worth briefly just touching on the coding. So the new LTC annual recall system uses particular coding to support the patient pathway and reporting. We've designed this to be as straightforward as possible, and Hazel will show you during the demo how these codes work in practice and where to find all of the supporting resources. It will make it much more sense when you see it in context rather than just talking through the list of codes here. But to kind of summarize at a high level, these are the codes that will move the patient through your recall journey. So there's a single invitation code, which will be used for all invitations. A did not attend or follow-up code, which can be used to remove a patient from the recall process from the year. There's an assessment code for initial assessment, and there's 2 review codes, one to show the review has started but isn't complete, and then one to mark a full review, which completes that whole process for the year. So we've looked at what's changing, why we've introduced the new recall system, what your transition timeline looks like, and the overall pathway. The best thing to bring all of this together now is to physically see it in practice. So I'm now going to hand you over to Hazel, who'll take you through the live demonstration in EMIS and show you how you can start using the system within your own workflows. So over to you, Hazel.
Thank you so much, Mariette, for that introduction. Good morning, everybody. My name's Hazel. I've probably met quite a few of you before. So we're going to get straight into the live demonstration. And just to say, I am going to switch my camera off now because my screen that I need to look at is over here, and I don't want you to keep looking at the side of my head. And I probably will wave my arms around a bit as well, so it might be a little bit off-putting for you. So let's get straight into it. Let's start off with, as Mariette said, this is done in 5 stages. Let's start off with looking at the planning stage. So you'll find this suite of searches within population reporting, within your Ardens search folder. Now mine says Ardens training searches, yours will only say Ardens, so don't worry about that. When you open that folder up, the very first folder is the new recall system. So folder number 1, LTC reviews, new. And the latest version is version 1.5. I'm pretty sure that all of you will be on the latest version at the moment. When I open that folder up, click on the little arrow to the left-hand side, this is the first decision that you need to make as a practice. Now, as Mariette said, we're bringing into this recall system more best practice conditions that need a review throughout the year. Now, it might be that you're saying, oh no, we can't include those because that's too much work. But you're probably already doing that. You're probably already seeing those patients, but you might be managing them slightly different with the way you recall them. So you might have a separate recall process for that with another group of staff doing those searches. So by using these, it's incorporating everything all into one invitation. But that's not to say that you have to incorporate those best practice conditions. You have the choice, and you can change that at any time. So we've got 2 folders within inside this folder. The first one is if you want to just stick with your QOF conditions and IIF, so learning disabilities, then you would use the first folder. If you want to include all of those additional best practice conditions that Mariette mentioned and we saw on the slide, then you would use the second folder. The process of how you do this works exactly the same. It doesn't matter which folder you use, it works exactly the same. For the demonstration today, I'm going to use the top one. I'm going to use QOF and IIF. And what you might want to do as a practice, once you've made the decision as to which folder you're going to use, you might decide to right click and delete the other one. It just takes away that folder. It takes away the potential for error by using the wrong searches. Somebody else might be looking at the wrong searches and therefore looking at the wrong results. So just delete the folder that you don't want to use. We can always get that back in for you, or you can download it again from the portal at any time if you want to. So let's open up the QOF and IIF folder. And in here, you can see that we've split it between annual reviews and interim reviews. So those reviews that need to come in for their yearly reviews and those conditions where they need an additional review after 6 months. So we'll start off with the annual review folder. And as I've opened that up, there you can see those 5 stages that Mariette was talking about. So let's talk about the planning stage to start with. This is usually going to be done by your management team, probably at the beginning of the year or when you first start using this system, and then once a year moving forward. Most of the searches in here are for information only. They're for information, and they're to help you identify and make sure you are calling the right patients in. So the first folder we have in here is a condition folder. It's purely information. This is just breaking down how many patients you have on each of those registers. And the very top report will show you all of the patients. So this can give you just a very, very rough idea of numbers that you're going to be looking at throughout the year. Then we have an exception folder. Now, as Mariette said in the presentation, you have the ability to remove someone from the recall system for this financial year. And that is adding a clinical code to their records, default from follow-up. It just removes them from the invitations for this year. And this report here just gives you that information, which patients have that on their record. So if we viewed the results of this report, if you were to run this now, you would probably have very, very low numbers in here because you're probably not using these codes at the moment. But moving through the year, you will get more and more patients in here, and it will show you the date that that code was added to the patient's record. So really information only. We then move down to the recall month all. Now, just like the previous recall systems, this system is based on birthdays. So we're looking at patients born in a certain month who have the condition that we're needing to review them for. They haven't already had it done this financial year, and they haven't already been invited. So this folder here is purely giving you numbers. It's not saying you're going to review all these patients, because some of them might, for some reason or another, have defaulted from needing a review. This is purely giving you the numbers so that you can plan your clinics. You can have a look and see over the course of the year, what's the spread of appointments we're going to be needing. As we move down the next folder, this is saying recall month chosen. So although the basis of this recall system is based on somebody's birthday, if for one reason or another, either they decide or you decide that it's not appropriate for them to come in on their birthday, you can override their birthday and choose a different month for them to be recalled. And this folder in here just identifies how many patients you've got. And if you view the results of the patient report, this will show you who those patients are and what month they've chosen to come in. So my first patient, we can see their date of birth is June. However, they have a diary date, chronic disease recall, added for August. That means that this patient will always come in when you do the August birthdays. So again, this report is purely for information. So this shows you the chosen month. The one above shows you the patients born in that month, but also those patients who have chosen to be recalled in that month. So it might be that you have a spread that is quite even over the whole of the year until you get to July, and then you've got a lot more patients. It just identifies potentially you're going to need a lot more appointments when it comes to your July appointments. And then you have a folder called Review Before. Now, this is a folder where we are expecting you to do a little bit of work. You don't have to action all of them. Some of them are more for information, but some of them certainly will need action. The first two reports in here for this financial year, where you haven't been using the coding that we're going to be using in the new system, you're generally going to find that there are 0 patients in there. But moving through as the years come on, you will get more and more patients in there. The first one is identifying these patients are born in Q4. However, they had their review in Q1. So potentially these patients could go nearly 2 years without you inviting them. So it's information. What would you like to do with these patients? The second one's the other way round. This is saying they're born in Q1, but they've only just had their review in Q4. So you might be recalling them pretty soon after they've already been in. Again, what do you want to do with these patients? Now, the next two reports are reports that you will need to have a little think about and do a little bit of work on. This one here that says query, consider coding default from follow-up. Now, this list of patients is going to be your vulnerable patients. So your learning disabilities, your patients with dementia, maybe your end-of-life patients or your young patients. The idea is you would view the results of this report. You would go into each patient's records and make that decision. Is it appropriate for them to have a recall? If the answer is yes, you do nothing. If the answer is no, you add the code to their records, default from follow-up. And as you can see, we've given you the SNOMED code in the title of the search. For a lot of these reports, if you look in the bottom half of the screen, in the description, we will tell you what the search is all about. So here we're saying to you, consider coding default from follow-up if you wish to remove them from the recall invitations. And the next one is very similar. Again, it's deciding whether you want these. So these patients in this report, these patients have got a reasonable adjustment. For some reason, they have the requires reasonable adjustment code on their records. And what we're suggesting here is if you want these patients to appear in a separate suite of invitation searches so that you can consider how you invite them, then we're suggesting you add the reasonable adjustment code again, as well as adding a code, patient recall admin. And again, bottom half of the screen, we've told you what codes they are. Adding those two codes together will remove the patients from the bulk invitation searches and put them in a folder of their own so that you can consider how you invite those patients. It might be that you want to, individually invite at certain times. I'm not going to go into any of the others in any detail, so have a look at the other searches and consider whether you want to action any of the others. And our support articles are very clear about what all these searches are all about and how you need to action them. So don't think you've got to remember everything I'm talking about today. And then we have the setup searches. So the setup searches are generally helping practices who are using one of our recall systems at the moment. So if you're using either any of the Ardens Recall A, B or C, then once you've decided, yes, you're going to switch over to the new recall system, then you would need to action the searches in here. We've got a really good support article talking you through how to action them, but the very brief overview, the top one is saying you have coded these patients as having all of their annual reviews complete as of using the old codes. We're recommending you bulk add the new annual review completed code so that it then pulls them through correctly into the searches for this year. And the second one is identifying some of their reviews are completed according to the old coding, but not all of them. So review these patients' records and decide how you want to action them. The other ones here are about changing coding. So previously you did have the ability to override someone's birthday, and that was by adding a code, recall arranged. But moving forward, it's going to be a diary code. So that is saying you need to change the recall arranged code to the diary code. The next one is suggesting you might have used the code chronic disease monitoring not required, in which case you would change that to the default from follow-up code that we are implementing in the new system. And then the final one is just identifying all of the coding that we are using in the new system. For those of you that are already using one of our recall systems, you're probably going to get very high numbers here. That's fine. Don't feel that you've got to action all of those records. This is just identifying these are the codes that somebody is using now. Have a look at them. What is the purpose? And just if they're using it for some random reason, then letting them know that actually these codes are going to affect the recall system moving forward. And we can go through all of these in much more detail when we do practice level training. So that's your planning stage. We're now going to move on to the notifying stage. So this is your invitations. And we have various folders in here. You're not going to use all of these folders. There's various folders depending on how you want to work within your practice. Now, to start with, I'm just going to go straight down to the bottom and say we are separating out your patients who are living in a care home and your patient who are housebound. So your general invitation searches will not include your care home and housebound patients. The care home and housebound folders are not looking at birthday month. because generally speaking, practices just want one list of patients. This is your list. You're going to deal with them as you feel fit. You know, you're probably going to give a list to the people who go out and do the home visits, and they will action them from that list. So when you run these folders, it's just a case of right click, run, say yes, and then that's going to run the report for the whole year. It's not breaking it down by birthday. So that's your housebound and care home patients out of the way. We're now going to go back to look at the other folders, the invitation folders. The very first one, I would say only use this folder for information. Don't use this folder for to send invitations, because this is including everybody. And you probably don't want to invite your dementia patients the same way as you want to invite your general healthy diabetics and hypertension patients. So just be very careful about the all folder. Now, the asthma only folder is going to be very helpful for those practices who do something different with asthma patients. So asthma patients, according to our clinical team, they're the only patients that don't really need to come in and have a face-to-face initial assessment. And what a lot of practices will do, they will send the asthma questionnaire to asthma patients, get them to fill that in and send it back. And then depending on the results, you then will make that judgment. How are you going to follow that patient up? So if you are going to do something like that, it's really important that you run this folder first, that you action it first, and that you code it first. Because as Mariette said in that introduction, there is one invitation code that covers everything. So these patients here at the moment, before we've coded them, they will also be appearing in the other folders. So the idea here is you would right click, select run. When you say yes, this is where your date parameter box is going to come up. And what we would recommend you set this at, recall month is on, the month, and then each month, this is where you're changing the month of birth. So just like you're used to doing at the moment, and click OK. Once the report has run, the report will show you in here those patients who need that first invitation. So you haven't coded an invite yet. So just like you do at the moment, I'm afraid I've got 0 in here, but we'll look at this in a bit more detail in a minute. You would view the results of that report. You would have a report in here with all those patients' names. You would export it to CSV, and then you would upload it to your text provider just like you do at the moment. So you send that invitation and you can link the asthma questionnaire to that invitation. The important bit here is the coding. This is the code that we are using to ensure that the patients flow through this invitation suite. It's the same code for everything. So I've done my first invite. You may want to attach this code here to your text provider's template so that that automatically codes it into the patient's records. Now, I'm sure some of you have already realised this is not a QoF invitation code. Absolutely correct, because this is not just a QoF recall system. Therefore, you might also want to batch add the QoF code at this moment in time. There is one generic QoF code that covers all conditions. If you were to look at your GP contract searches, you would see that this generic QoF code is a personalised care adjustment that removes them from the denominator once it's been added to the patient's records twice, more than 7 days apart. So if you add this code to the text, you can then batch add clinical code. Now, some of you are quite used to at the moment having to batch add, 8 or 9 different codes. You only need to do one. So click on the magnifying glass to go to your batch add screen. And in here, if you look for the QoF generic code, which is this one here, QoF quality indicator related care invitation. If we look over on the right hand side, this is the SNOMED code that ends in 106. You select that code just like you do at the moment when you're batch adding. EMIS has decided it's going to throw a little wobbly. Apologies. There we go. So we're batch adding that code to all of those patients' records here. So just like you're batch adding at the moment, you would go through the batch add screen of how you do things now. Just going to briefly do it. So you could put a description in here. I might put April batch invites. The search population is always population included. Then you need to go and search for this search and you click on OK. And that is going to batch add the generic QOF code to the patient's records, and you've already added the invite code to the text message that is going to move the patients through the suite of searches. So that's your first invite. Your second invite is not looking at birthdays, just like now, you know, the ones that you're using at the moment are not looking at birthdays. But what these are looking at is purely that invitation code has been added to the patient's records more than 2 weeks ago, but less than 3 months ago. So these are your patients that you can then go and send a second invite to. Exactly the same. You view the results of the report, you export it, you upload it to your message provider, you attach the same invitation code to the text message you're sending, and then you go to the report, to the search, and you batch add the generic QOF invite code. Now, nothing's changed for QOF. You still only need to do 2 invites. However, best practice, it's advised you do 3, completely up to your practice. If you want to do 3 invitations, if you don't, fine, stick at 2. If you would like to do 3 invitations, then you would move down to the third invite report. And this is looking at patients who have had the invite code on their records twice, more than 2 weeks ago and less than 3 months ago. So that's your asthma patients who have only got asthma taken out of the main invitation searches. So they are dealt with. They've got your asthma questionnaire, you've sent them the invitation, you've coded the invitation. Now we move down to the other folders here. Now you have a choice of which of these folders you use. You will definitely be using the consider method folder. Now the consider method folder is very much like your vulnerable folder that you have using at the moment. So your dementia, your end of life. And it works exactly the same as all of the other folders. Right click, run, select yes, and you're setting, I don't know why my EMIS keeps moving to this, you're setting your birthday month in here. And that will then run the folder. Now, if you have already run those review before searches and you have removed certain patients from the invitations searches by adding the default from recall code, then they will not appear in here. So you may get 0 in end of life because you have removed them all when you did that review before search. And then you would invite these patients as you feel is appropriate. So very, very similar. You view the results of the report. Now, all of these reports give you the patient details, and it does identify each of the conditions that those patients have. So probably for these consider method patients, these are vulnerable, and you're probably going to be inviting them individually, but you're doing exactly the same thing. You are coding that invitation code that we are using to move them through the recall system, and you're coding the generic QOF invitation code. Now, your next folder that you use is down to you to choose. You will either use the excluding consider method folder, or you will use by LTC group. Now, the LTC group will be very similar to those practices who are using System C. This is breaking it down by those patients who have a cardiovascular condition, renal or metabolic. It's breaking it down by patients who need a mental health review and those patients who need a respiratory review. So breaking it down into 3 separate groups. Remember, some of these patients will overlap. So if you're using this folder, some patients will get 2 and potentially 3 first invitations, and running it and coding it at the same time so that they then move through the invitation suite. However, to make things slightly simpler for you, rather than breaking it down by condition, we would recommend the excluding consider method, which is just everybody who can get a generic invite. And it works the same as all the other folders. So you would right click and run the whole folder, choose the month of birth. You would view the report for the first invitation, and you would export it and upload it to your third-party provider for sending that text message out. Now, if you are wanting to separate conditions out, the idea here is you are sending a generic invitation out for an initial appointment with the HCA. If those initial appointments are going to be different time lengths, then you would need to filter this once you had exported it to CSV. But generally speaking, the only one that you might potentially want to give a little bit longer appointment is those diabetic patients, because they might also need a diabetic foot check. So if that's the case, once you've exported it, you could filter the column for diabetes, select all of the ones that say yes, and upload those first with maybe a slightly longer appointment. And then everybody else, you're sending a generic invite to book an appointment with the HCA. Same thing goes, the generic invitation code here, and you batch add the QOF invitation code. And you've run through exactly the same. You've got your second invitations and your third invitations, should you want them. So that is your invites done. You have got a chasing folder in here for patients who've been invited more than 3 months ago, bit of a safety netting suite of searches. Now, what happens now is either your patient is going to call to make an appointment, or they're going to book into the booking link that you've sent them. So if they call to make the appointment, for your reception team to help identifying what appointment they're making, we have a launcher to add to your F12 key. Now, this launcher is going to be beneficial for all of your staff, from your reception team to your HCAs, to your nurses, to your GPs, and probably also for your admin staff. So reception team, double click the launcher. And this will identify what conditions the patient has. It tells them that their recall month is their birth month. If they had chosen a different month, it would say that here. But the important thing for reception is saying these are the conditions the patient have. Now, anything that starts with an asterisk, that is a QOF condition. So either a QOF condition or an LD condition. If it is just a best practice condition, it won't have the asterisks. So really important to let your reception staff know about that feature. You do have the last codes of the date that codes were added. So the last invite code, the last initial assessment, the last annual review codes. But for reception, probably all they're interested in is what condition do they have. I'm going to click on the book appointment option to take me to the find slot screen to make them an appointment for that initial assessment. If they don't like using the book appointment slot screen, absolutely fine. They would just click on exit and make the appointment as they see fit. So that is the appointment made. And the next step is the patient is coming in for that initial review with the HCA. And the HCA would use exactly the same protocol. Ardens Launcher, LTC Annual Review. And I'm going to double click it. It opens exactly the same launcher. Now, as the HCA, I'm going to choose the option Initial Assessment and Tests. And this is very much like the multimorbidity initial assessment template. It is going to be specific to the patient. You're going to see different data depending on what conditions the patient has. On the home page, you have the really important code to identify I have done the initial assessment, and therefore that is the code that will remove the patients from getting any further invitations. The process has been started. We are letting them know that anything with an asterisk is a QOF code. We're providing previous entries of these important codes over on the right hand side. They can click on the 2 little arrows to look at it in more detail should they need to do that. As you go down the home page, they have the ability to overwrite the patient's birthday month. So let's say the patient comes in and says, well, actually next year, can I come in July? Because my wife comes in July and I don't want to come in January or February. We want to come in together. So at this point, you could add the diary date, chronic disease recall. You can set it for any date and any year in the month that they want to come in. And that will then go into the patient's diary. And it will then mean that that patient, when you run the birthdays for July, that patient will come in the results and get called in July, as opposed to February when they're born. You also have on this page the ability to default them from follow-up. So as I said, you have the option to remove them from the recall system. There's the code there. We would always recommend you pop a reason in there so that anyone looking at the records, it makes it very clear for them. As you move down the screen, it's information. You will see all of the conditions listed on the left-hand side. It will only be on the right-hand side that you can identify whether they have those conditions, because you will see the previous entry, you will see the previous date. Now, this is information only. You don't need to worry about this because this is going to be identified within the actual data capturing pages. So if I move across now to the lifestyle page, very similar to the templates they're using at the moment, all of the information around lifestyle. Now, remember, it's down to your practice to decide what you want to complete. Nothing is mandatory. If you don't want to complete all of this information, absolutely fine. You choose what you feel is appropriate for your staff to be completing. Remember, anything with an asterisk in front of it is a QOF code. So here we can see smoking status, that's a QOF code. However, e-cigarettes, that's not a QOF code. So if there's vaping, you still need to use a QOF code to tick the box for QOF. So you've got smoking, you've got substance misuse, you've got frailty, you've got carer, you've got lots of data in here to capture if appropriate. Then we move to the cardiovascular, renal and metabolic page. Now, depending on which conditions the patient has, depends on what you're going to see in here. If my patient doesn't have AF, I will see an AF screening section. Now, it might be that you say, well, hang on a minute, my HCA is not going to screen for AF. All they're doing is taking their pulse, they're checking their heart rate, and they're asking about palpitations. CVD can often be prevented by encouraging people to lead a healthy lifestyle, stop smoking, reduce alcohol. If these risk factors are spotted early, it reduces the chance of patients going on to develop cardiovascular conditions. So therefore, capturing all of this data means that when your clinician reviews the records, they can see all of this data that's been captured, and it might highlight to them, oh, hang on a minute, that the patient's got problems here. We need to have a bit more of a discussion to try and prevent them from developing a cardiovascular condition. We're also moving into these templates, the traffic light signals. So here we're saying to your HCA, if the pulse is between these values or they are symptomatic, it's putting a red flag. They probably need to have an appointment sooner rather than later. So it's just information. Ticking for urgent GP appointment will not do anything. Remember, it's only coding it to the patient's records, but it's identifying to the HCA, actually, you should probably do something about this. And as we move down the page, again, if my patient didn't have hypertension, it would say hypertension screening, so that you capture their blood pressure, so that when your clinician is reviewing the records, they can identify, do we have any issues with this patient's blood pressure? The prevention section will be dependent on what conditions they have. Because my patient already has cardiovascular conditions, this section is saying this is secondary prevention. If they didn't have any, this would say primary prevention. And then moving down are the questions that you, as an HCA, could potentially be asking around those cardiovascular conditions. Remembering that the key points for QOF will have a star in front of them. And they would go through these pages, completing as much data as they can. And then you've got the test page, which is now identifying what blood tests does this patient need. It's pulling all of that information into this template. Just like the blood test due analyzer, we've got the warning triangle. It's not due, it's due now, and we need to take this blood. The egg timer, it's not due yet, but it's due some point in the future. It's trying to streamline everything and pull it all into this one appointment. As you can scroll down, the page will then identify why the patient needs that blood test and how frequently it could be done. And then, if appropriate, there will be a tests other page. And they save that into the patient's records. Now, by adding the code initial assessment, that has moved the patient through the search folder. And it will move these patients now into the review folder. And before I go into talking about the review folders, I'm just going to pause because I've just realised I have spoken for ages and not checked in Are there any questions, Mariette, that you want to bring to the floor, or anything that needs to be verbalised here?
Thank you, Hazel. There's not many questions here today, but there was one that might be worth just pointing out. So somebody asked, what happens if we invite a patient for a diabetic review and add the code, but we haven't invited them for their asthma? Will they still appear on the report as they have asthma invite outstanding? So correct me if I'm wrong, but I have said that obviously once you add that invitation code on, it moves the patient on to the next phase. So make sure that you've invited for every single thing you need to invite for before
absolutely.
adding.
Yep, absolutely, Mariette. So historically, you'd been using different invitation codes, which was separating them out, and they would still be in there if they hadn't had all those invitation codes. Because we are now using only the one code, you're right, that is inviting them for all of their conditions, which is why I said when you run the searches together and action them together. So if you're wanting to invite your asthma-only patients first, run this folder, code them, and then move on to the next folder and run that, because otherwise they will be appearing in the other folders. But when you go down to this folder here, if you are filtering out your patients and you are separating them out, you are still adding the same code. So if you're separating out your diabetic patients, you're adding that generic code. As long as you don't run the reports again, your patients who also have asthma will still be in the report. So make sure that you do everything all in one go. Hopefully that's answered your question.
Thanks, Hazel. That's it for questions.
Okay, so moving down to the review stage. So my patient has been in, they've had their initial appointment. And the idea is what we're trying to do is we are trying to save face-to-face appointments. We're trying to streamline processes and only pull those patients in to see the clinicians where it's generally needed. You know, they really need that clinical input face to face. So the patients will move through into the review folder, folder number 1, to review. The initial assessment has been done between 3 days and 3 months ago. And the idea is here that somebody would open the folder up and would do that notes review of those patients. Again, we have different folders for you to select which folder you want to use depending on how you work as a practice. You might want to go through this folder because these patients are only in one group, which if you're giving the results to different people might be more beneficial for you. Or you might want to use this folder because these patients only have one condition and therefore you can quickly review these patients' records. Or you might want to use the all folder, which again is broken down by these patients have a cardiovascular condition, all of them, any condition, or I'm only interested in looking at the diabetic results, or I'm going to do everyone. I want to know everybody who's had a review who now needs their notes reviewing. So you view the results. It tells you the date of the initial assessment. It does tell you what conditions they've got. But what I would be doing would be copying the EMIS number. So I would highlight the EMIS number. I would go into the consultation and paste that number in. I could then have a look at their results in here. Or I could use the review template. So I click the same protocol. This time I'm opening up the review template. Now, from a clinician's point of view, if you were reviewing patients' records from their notes, you would get through a lot more patients than you would if you were reviewing them all face-to-face. So hopefully, in the long term, this is going to save your clinicians time. So we'll come back to the home page in a minute. I would be going through these pages, and remember my patient's got quite a lot of conditions, which is why I'm seeing a lot of pages. I'm opening the pages up. I'm reviewing the data that my HCAs have captured over on the right hand side. I'm looking at that screening information. I'm looking at the results here, and I'm identifying, do I need to do anything around these results? I would then go on to each of the condition pages, and again I would be reviewing the results that the HCA has captured. I might do some more, I might do a medication review here. I might also add some more details in here from their notes. I might decide, actually, I've done everything now. I can say I've done the AF annual review, and the reason we've put this review section in here is If you want all of this data to be sitting in the consultation under the AF review heading, then you can also add a diagnostic code as a review code. Now, really, really important that you are adding the same code that is already on the patient's records. You can see it over on the right-hand side, and checking that this is a review. What you don't want to do is add a new diagnosis code. So this means that this will sit nicely in the consultation when you go and view that consultation. So I've reviewed this from the results that the HCA has said. I'm coding that their AF is controlled. I've got no worries here. I'm moving on to the hypertension condition. And again, I can do the same thing. Yep, their blood pressure's fine. I'm having a look at any other data that was captured. I'm deciding that they are well controlled. I'm doing a medication review here. I'm writing some information about the consultation, and I'm saying, yep, I've done this hypertension annual review. Now, these codes here are purely your choice. These have nothing to do with the recall system, okay? It's purely going to be adding these codes into the patient's records. So the idea is that your clinician reviews the notes here and then makes that decision. Do I need to see this patient? So on the home screen, if you have reviewed everything is fine, you might have made a quick telephone call to the patient to say, I've just checked all your blood results, everything's fine. Any concerns? No, fine, we'll see you next year. This is the code to remove them completely from the recall system. Now, it might be that you have processes in place already for this stage. If that's the case and you want to carry on following those processes, that is absolutely fine. But this code here is going to remove them from any further searches to do with the recall system for this financial year. However, if you've reviewed the patient's records and you decide, actually, their blood pressure is a little bit high, they're a little bit overweight, I do want to see this patient, I want the patient to come in and have a follow-up appointment. If you want the patients to fall into our safety netting searches, then you wouldn't use the completed code, you would use LTC annual review. This code really, it's denoting the review has been started, but it hasn't been completed yet because I want this patient to come back and see somebody. And in here, you can add free text to whatever it is you want to do. So it might be maybe that you have only completed the diabetic part of the review, in which case I might just take that out completely and do diabetic review complete. That means that the patient is going to fall into the safety netting searches. So you add whichever code is appropriate. If we go back to the searches now, if I have not completed the review for all conditions and I've only used the annual review code, the patients will then fall into to complete. The review has been done but not completed. Safety netting searches. And in here, exactly the same as the other suite of searches, you can then go and have a look and see who are these patients that haven't had a full review finished yet. Let's go and look at their records. Has everything been done now? Can I then add that complete final code? So that is the reviewing stage. And then to finish off, we have the evaluate stage. So this is a suite of searches just to give you information on activity that you have done within the practice. And we're breaking that down by activity that's done last month or the activity that has been done over the whole financial year. And this is things like how many reviews you've done, how many invites you've sent, and so forth. So that was the annual review. Now, just for information, I'm just going to open up that protocol again. If anybody wants some care plans, so some printed out care plans, then you do have the option to select the care plan here. This will then open the care plan up and it will save it into the documents tab of the patient's screen. The other option that you do have in this protocol, if you are purely wanting to look at a QOF template, what has been achieved for QOF, you could open the contracts QOF template. This is exactly the same as the QOF analyzer down. Oh, sorry, I've got consultation open. The QOF analyzer down in the pink box. So let me try that again. It's going to open the template relevant to the patient. It's going to start off with all the indicators that are outstanding for them with the red exclamation marks, all the coding there to either achieve or exception report. And as you go down, you will then get the green writing for those areas that you have already achieved. So that is your annual review process. Finally, just going to touch on the interim review folder. So within the interim folder, the layout is very, very similar. So in the notify section, this is showing you these are patients who need to come in for a 6-monthly diabetic HbA1c or a 6-monthly heart failure review. So these are based on the coding of the annual review completed code. So it's looking for that code added more than 6 months ago, or for your diabetic patients, it's looking for a HbA1c to have been added during that time frame. So she says that is the recall system. Any questions, Mariette, before I move back to the slides to wrap up here?
Thank you, Hazel. There was just one more question that's just come in that says, for people who use the NCL LTC LCS searches, which I'm guessing is a very local folder, they have MDT review searches where they book the patients into pharmacist appointment slots to review and complete the model of care. So the question is, can the review folder be used in the same way alongside those folders?
Good question.
It's a good
What's
one,
the
isn't
answer?
Wow.
I don't see any problem with using them. Just bearing in mind that what the coding is going to do with regards to moving those patients through that recall system. So I think probably they could be used, but I think maybe we should cover that in more detail with you as a practice individually. So either get in touch with our support team with that question, or if you've got any training booked, then we can cover it with you individually. Okay, so perfect. I am now going to move to wrapping up here then. So what I'm going to say is, where do you go from here? Oh, why won't my slides open? Interesting. Okay, so how do we go from here? Decide on your switchover date. As soon as you have decided on that switchover date, make sure all your staff have had training. Remember, our training is free, so book your training in at practice level. Make sure your clinicians know that switchover date. Make sure that they have had training on the templates, because the coding in the new templates are different to the coding in the multimorbidity templates. Make sure your admin staff have had training. Make sure they are aware of those new invitation codes and how to use them, so that you can make sure everything is done as appropriate. And let's move on to talk about training. So training is available at practice level, as I've said, but we're also doing these webinars every other month. So every other month, we're going to be going through these recall webinars for the whole of the year. So there's no worry that this is your one and only chance of seeing this new system. I would recommend you book training in at practice level, because we're then going to be able to talk about how you work as a practice, how it's going to work for you, any idiosyncrasies that you have, and how we can help implement those with the new recall system. Get in touch with our training team. So there's the email there, training@ardens.org.uk, and we can get that training booked in for you. We've also got really good support articles talking you through this process step by step. I'm sure that Mariette's put a link on the chat for that. And any help that you need, you know, if you've started this, I noticed one practice had started already. Any problems, any issues, please do get in touch with our support team. We've got a really good support team who will be able to help you with your query. And if needs be, we can escalate that query to the training specialist to do a one-on-one little Teams call if that is appropriate. And finally, thank you very much for your time. Phew, look at the time. That was more by luck than judgment. Thank you all so much for your time this morning. I hope you found it useful. Your feedback really is important to us. We want to make sure that these sessions are as useful as possible, that we're covering all of the information that is helpful for you. Click on that QR code and send us your feedback. Any feedback, good feedback, bad feedback, we take it all on board. And if there are no other questions, if you want to leave the meeting, just click on the red leave button. If there's any questions, keep putting them in the Q&A. We will hang about for a few more minutes to see if there are any questions. If there's any questions that we haven't got round to answering, don't worry, we will look at them after the event, and we will make sure we get back to you with any questions that you've had and we haven't been able to answer. So thank you all very much for your time today, and have a good rest of your day.